Welcome, everyone, and thank you for joining us here at Electra Health. My name is Laura Strati. I'm one of the guides here and super excited to be connecting today with all of you and with our founding physician, Anna Barbieri, not Mia Barbieri, that's her daughter's account. And Anna is our amazing founding physician. She's a board certified OBGYN practicing in New York. She's also board certified in integrative medicine. So she really brings that kind of integrative, holistic approach to care. She is fantastic. And we have got a really cool topic. This is a la David Letterman, a top 10 list. We're going to try to get through this top 10 things that every woman should know about menopause. And 10 is a lot to cover in like 25 minutes because we're going to leave a few minutes at the end for any Q&A you might have. But we'll get through but this is kind of a top level overview. If you have any questions, you can put them in the chat along the way and we'll get to them at the end. But Anna, I'm going to hand it over to you.
Thanks, Laura, so much for that intro, and hi everyone, and welcome to this talk. There is no way that we can cover everything about perimenopause and menopause in like 30 minutes. I do want to say, Laura, I want to add one more thing to my bio, and that is that I am almost 49 myself, so I certainly know what it's like to be in the throes of perimenopause and what it means to like not sleep and gain weight and have night sweats and have hot flashes and all of that. So I have been there and done that. And actually, because I started to go through this transition relatively early in my early 40s, that's how I actually, that was the initial time when I took a deep dive into this topic. And prior to that, I was your typical OBGYN who stayed up lots of nights delivering babies. So that was one chapter. And this is sort of the next chapter. And I really love it. I love connecting with other women in our age group and kind of talking about how we can feel better and get healthier. So we'll go through our top 10. And again, Laura, Beth, you know, the whole Electra team knows I could talk about this forever and ever. So I will try to limit myself here and kind of go through the top 10 list. Starting with number 10, I guess we'll do it Letterman style, really going through 10, from 10 to 1. Starting with number 10. So menopause should not be a taboo topic. For too long, we just haven't really been talking enough about it. We've been embarrassed to talk about it. There hasn't been much out there, or there has been a lot of just confusing information about it. And it's something that even in families or friend groups has not been much talked about. I think, you know, we kind of live in a culture that values youth and fertility quite a bit. And then we get to be 40, 45, 50, 55, and all of a sudden, a lot of women feel like it's time for us to kind of recede from the main stage of life. And we're here to change that. So let's talk about it. Let's be open about it. And let's really just exchange some good information. Number 9 is that the menopause symptoms do tend to get better with time. It can be a rocky transition. So if your puberty was pretty rocky, we can remember that. And menopause and perimenopause in particular is not dissimilar. So it's really the time, and unfortunately that time can be long. So it can be years even, when we transition from regular cycles, regularly fluctuating hormones, to kind of those postmenopausal years when our sex hormones are low and steady. It's really that transition that can be most problematic for some of us. And it can last for, you know, that time can last 2 years, that time can last 10 to 12 years. So it can be pretty long. It can feel like forever, but it doesn't last forever. Number 8 is that there are lots of solutions for how we feel during this time, and we'll get to number one that eventually that talks about how we can feel during this time and the different symptoms we can experience, but there are solutions for them. And there are some very powerful solutions out there, like, for example, hormone therapy. But there are other ones too, whether it is lifestyle adjustments or whether it's dietary changes, whether it's herbal supplements, especially those that have more evidence of both safety and efficacy behind them, whether it's acupuncture. There are definitely solutions out there that can be tailored to us as individuals. Hormone therapy has gotten a very bad rap over the last 20 years or so. Prior to that, and I definitely remember those days in my training when it was considered kind of good for everyone, good for everything, fountain of youth, and then it sort of got this reputation that all it does is cause breast cancer. We've moved far beyond that and know that hormone therapy can actually be quite beneficial for most, but like all tools out there, and especially like most medical tools, including medications, it definitely has both its risks and benefits and should be really tailored individually. So I do think that all of us really deserve to know information about it and have that conversation about menopause tools, including hormone therapy, with our providers and our doctors. Number 7 is shifting gears a little bit here. Menopause is a time when our body does change. I do think that many of us, and I would count myself in this group also, actually have a little bit of trouble accepting that. There are changes that happen with time. There are changes in our shape. You know, prior to perimenopause and menopause, definitely most women, and not everyone, because we're all made a little bit differently and we all look a little bit differently, but sort of most of us tend to carry our weight in our butts and hips with menopause. That changes. And there is that, you know, abdominal weight gain, that little bit of a pouch, that little bit of a tire, and that happens for a number of different reasons. It has reasons that are hormonal. It has reasons that are, and by hormonal, I don't mean just relating to our estrogen levels. Hormonal reasons also relate to things like insulin, which is a hormone that's released when we eat, when our blood sugar goes up. It can have something to do with cortisol, which is a stress hormone that goes up with age, and also with all the stuff that we're exposed to in our phase of life, whether it's children, families, jobs, parents, you know, all the stuff that's happening in the world now. All of that, higher cortisol levels will lead to that. We tend to sleep less and move less as time goes on. And that also has to do with things like our melatonin levels going down and changes in lifestyle. So there's a lot of different reasons for that change in our body shape. And I hear this all the time, you know, people come in and say, I'm eating the same way, I'm doing the same things, I'm even exercising more. And you know what, my waist is expanding and I can't seem to be losing weight. And some of it is because there are factors like time, like some of the hormonal patterns, and like our genetics, that sometimes we cannot, some of these things we can't change. They're just variables that are there. The good news is that we can adapt just like we adapted in puberty, right? We didn't wear the same clothes at 16 that we did at 10. We can adapt not just with changing our clothes, but maybe with changing how we live, how we eat, how we sleep, how we approach ourselves with maybe a little bit more patience and a little bit more compassion during this time. And with the tools that I just mentioned, whether it's pharmacologic tools or hormonal tools or supplement tools, that can help as well. Number 6 is sleep. Sleep changes a lot during this time. Sorry, I need to bring up, apparently my daughters Zoom account. I don't know how her name is on it, but I thought that was mine. Sleep is of paramount importance, and sleep changes a lot also now for some of the reasons we just mentioned. Cortisol goes up, stress goes up, melatonin goes down. Progesterone, one of the main female sex hormones, tends to decrease earlier even than estrogen does. Everybody just talks about estrogen, I feel like, with menopause. Progesterone is super important. Progesterone is actually something called the neurosteroid. So it's acts like a neurotransmitter in the brain. It promotes sleep. It promotes relaxation. When we get into our early 40s, even when we tend to have regular cycles and sleep tends to drop down and we start waking up in the middle of the night, often that is a sign of progesterone going down also. Estrogen going down itself can cause sleep issues as well. Higher cortisol, lower melatonin will do that. Our lifestyles will do that. There's a lot asked of us during this phase of life. So we tend to kind of be on the go and do all the time. And we don't allow ourselves the time or the space to really detach from everything. Exposure to, 24/7 work schedules, lack of division, right? A lot of us are working from home, at least sometimes. On one hand, it's nice. On the other hand, there is a little bit of a loss of that border between our work lives and our home lives. A lot of us use wine, frankly, to relax at night. So we know there is a greater sort of prevalence of heavier alcohol use in women in this age group. And unfortunately, alcohol does terrible things to our sleep, and sometimes even as little as one glass of something, and red wine will be worse than white wine here, will disrupt our sleep architecture. So how we move through all the different sleep patterns there. So got to pay attention to sleep, allow enough time for it, allow for time to kind of distance ourselves from the day and get ready for sleep, and really develop good both going to sleep and waking up from sleep habits. Number 5 is lifestyle. We can do a lot with lifestyle, whether it's incorporating movement into our day. Many of us lose muscle mass, skin changes, movement, and particularly doing some weights and training will help with that. Lifestyle also means allowing ourselves enough mindfulness and attention to make good choices for us, and whether those choices mean better choices about what's on our food plate, what's on our relationship plate, what's on our to-do plate, so to speak, professionally and personally. It's hugely important. And I am often, when I see my patients in practice, often I see people who come in and they want those hormones right away at the first visit. And we tend to initially work on lifestyle factors and changing even some simple habits. And I can't stress how often we find that doing things more holistically and doing things from the ground up, from kind of looking at our life, sometimes is enough. Yes, we do use a lot of hormones. Yes, we use supplements and all those other things. But really that is, I would say that's secondary to how we live our lives every day. Number 4 is mindset. And that's to me, that's huge. To me, that's something that is not easy. I think when perimenopause and menopause comes, we have such negative views of it that come from maybe how the world looks at women our age, and we tend to sometimes go along with it. And it's hard to not do that when we feel that our bodies are changing, when we feel that our brains may be changing, when when we know that that we are in the middle, that this change is coming, or we're in the middle of it. But I think the time has come finally kind of in history, and we have so many great role models to look up to now, that we can start thinking from the place of life is not just not over, but it's a whole new phase of life that's beginning. And it's something that's not easy to do, and it's easy to forget that in the midst of brain fog and mood swings and hot flashes and bad sleep and all of that. But we have to remind ourselves of that every day. I have to do that. When I talk to my patients about it, or when I feel crummy myself, it's not easy to come back around to it. But if we don't do that, then we're stuck in a place of just kind of negativity and hopelessness. And that's not going to get us out of there, no matter what prescriptions or herbs we use. So lifestyle and mindset, absolutely. I think maybe we should have put that as number 1 or 2 now that I'm looking at this list. Number 3 is that each one of us really deserves good care during this time period. Not just, we deserve to not be told that this is how it is, just put up with it, live through it, it happens to everybody. We deserve to have the fact that we're going through this change acknowledged. We deserve to get good guidance. We deserve to get knowledge and good and valid information shared with us. And we deserve to know what the options are. We deserve, providers who are compassionate and knowledgeable and know that this experience can be different for people. So just because you are seeing someone who is 60, who may have sailed through it, or someone who will never experience this, or someone who may have had a very different experience with this, or someone who may be 25. Like, this is not, this is not an experience that we all go through in the same way. It's a universal experience on one hand, because as long as we all live long enough, and hopefully we all do and we will go through it. But yet it can be very individual. So I do think it's time, especially in women's health, for us to move away from blanket statements and, one size fits all medicine, and acknowledge us as individuals here, especially in the menopause space. And finally, number 1 is going to come full circle to how this experience is different and is composed of a number of different things. There are definitely some bothersome things here. There's actually like 34 things on the list. Hot flashes, night sweats, these are the things most people talk about. Vaginal dryness, but there is also mood changes, having kind of that shorter fuse. There is anxiety and depression that some people are more prone to during this time. That's clearly hormonal. There is sleep disruption. So if you're waking up at 2, 3 a.m. with especially with that anxious feeling, that very well may be perimenopause and menopause. There is the forgetting of words. There is skin changes. There's burning mouth of menopause. That doesn't happen very often, but it can happen. There are more chronic changes in terms of bones and heart health and all of that. There is sexual changes, including libido changes and vaginal dryness. And these are just things that happen when these hormones change. Some of them can be slowed down. Some of them can be reversed. Some of them can be vastly improved upon. And some of them we cannot change. Like we all get here at a certain point. But menopause also comes with some positives. We get wisdom, we get experienced, we have another, lifetime to live. So we have to kind of get ready for that and live it the way we want to. If you think about it, if these changes hit us at 45, our life expectancy is 82, and many of us will be around longer than that. So not the time to kind of sit around and throw our hands up in the air and be done with it. So this is, I guess, what kind of my philosophy is. This is why I work with Electra, because we are here to kind of share this philosophy of sharing information and knowledge and help and guidance, but also share kind of this message of kind of more positive, accepting, compassionate life change that acknowledges our both unity in the experience and our diversity as individuals. So that's all I got.
Awesome, Anna. Thank you. I feel like there's a couple of clips in here that I'm like, okay, I need to like put that on replay like once a week just to kind of, keep my mindset up. But does anyone have any questions? You can put them in chat. This is a small group, so you can just unmute yourself and go ahead and ask. But really, this is kind of open. This is a broad topic of the top 10 things, but is there something else you would like to know about menopause? You've got an expert right here. We will see.
I have a question.
Sure.
Is there a benefit to getting like the lowest dose possible of estrogen or estradiol, or does it matter like what you're experiencing, what you're feeling? Should it be higher or lower? How do you know like when you've hit the right dosage?
Yeah, that's a great question, and it comes to it also relates to hormonal testing. So especially in perimenopause, hormone tests may not be very accurate because they will change day to day. That's not to say that we never do those tests, because they can give us kind of a broad hormonal picture, and they can also rule out other things that can look like perimenopause but are not, like thyroid disorders. For hormone replacement, right now, it's not recommended to follow levels of hormones to see if we're hitting some sort of a target, because there are no target levels of, for example, estrogen replacement in menopause as part of hormone therapy. So we go by symptoms mostly. We do test, for example, testosterone levels, and sometimes we do test levels in individuals for whom the usual doses are not working, or we're seeing unusual side effects. Normally, we would start with a low to average dose of estrogen and tailor it according to symptoms. And one can have symptoms still of either needing more estrogen or symptoms of not having enough. There are different doses of available estrogen preparations. Some of them will not be as effective for cardiovascular and bone protection. So for example, for women that we are starting hormone therapy on, or your average person that we're discussing those long-term benefits also, we won't start at the very, very lowest baby dose. We will start a little bit higher up to provide that protection as well. I hope that answers it. So, complicated question. I can, again, talk about it forever. So.
Yeah, it's hard to know. So many people have questions about like, how much should I take? What's the best? Is it dangerous? Is it not dangerous? So sometimes it's hard to know what to tell.
Yeah, it's
individual. How to approach it.
Because there are different ways of doing it. There is patches, there's gels, there is spray, there is cream, there is pills. So it's really something that has to be a balance between the risks and benefits of the particular preparation and what that individual wants, right? So if I have somebody who loves to swim and they swim 5 days a week, probably a patch won't be great for them because it may not stay on and it's going to kind of get yucky and all of that. So we may do something else for that person, for example.
So these are all, I mean, how you just explained it, I mean, that's a conversation. It's not like a 15-minute office visit when you're in, a standard clinic. So it's something that I think it's really important that if you are going to be talking to your doctor about that, do some homework. So like these words aren't brand new to you, but it's also calling ahead and seeing if you can make a little bit longer of an appointment time to talk to your doctor about this and have this be the sole conversation. Like, don't go in for your wellness visit and then want to tack this on. Like, you've got to make sure there's enough time because this is a nuanced conversation. Yeah, for sure.
Definitely.
Any other questions? We probably have time for one or two more.
Any way we could make this better in the future?
There was a question in the chat that was really interesting. Yeah.
You're right. Oh my God, I'm sorry. I didn't see it. Thank you, Grace. So 2, what do you recommend to use if you have a history of breast cancer in the family?
Okay, great question. So because it all depends on the amount of breast cancer in the family. There are women who have so much breast cancer and other related cancers in the family that itself may warrant different screening strategies or even genetic testing. So it's a very important assessment to make, as well as figuring out what your particular risk for breast cancer is. And there are actually calculators that are used for that. So because we know that hormone therapy, especially over time, after sometimes can increase the risk, we usually calculate that risk for our patients and are very careful with hormone therapy or don't use it if your total lifetime risk is over a certain threshold. But if you have, let's say your grandmother had the risk of breast cancer, nobody else, hormone therapy most likely is fine for you if you are okay with what your own risk is and what that risk elevation may be. So that in and of itself is a nuanced conversation also. There are certain solutions that are available to women at very high risk of breast cancer and those with breast cancer also that are going to rely on either lifestyle changes, on things like acupuncture, for example, or on things that are more in the supplement realm that are completely non-hormonal. And with supplements, we have to be careful with breast cancer because some of them will have estrogen-like and hormone-like qualities. That's why they work after all, right? But there are a couple of options there that are purely non-hormonal. And then there are also medications that are used. They are like real prescription medications that are non-hormonal that are used in a targeted way to target some of the menopause symptoms. So it all depends, and again, menopause is not one of those things where there's typically a one-word answer. Unfortunately, that's what a lot of that's what the 15-minute visit does, because it's frankly easier to say, hormones cause cancer, don't do them, and be done. That 15 minutes will cover that, but it is a more nuanced and a more complicated conversation than that, but there are definitely options there. And then I've read that if your symptoms start younger, then they tend to be more severe and last longer. It is true, but it's not necessarily true for every individual that starts. So yes, your symptoms, if they start at 42 and you have your last period at 46, that's probably by 48, things are going to be much more stable. Usually the fluctuations of perimenopause can be more difficult for women who've had either significant PMS or PMDD, which is like a severe form of emotional PMS, or postpartum depression. And for women whose mothers, sisters, other family members had a longer and tougher time with the experience of perimenopause too.
Great, thank you. So I think we have a little bit over, but I see one hand up. Beth, quick question.
Quick question. Anna, what would you say are your top 5 favorite supplements or herbs? And this could be for anything, whether it's sleep or skin and hair, nails, hot flashes. Like if we were to buy 3 to 5 supplements, what should we have in our, even calcium? Like what would be our top 5 things roughly?
Okay, so I would do magnesium as number 1, especially magnesium glycinate or magnesium threonate. Unless you can't poop, then if you're constipated, then you have to get magnesium citrate. I would say vitamin D is really important as well. I tend to check levels in my practice. Some people don't, but using, 1,000 or 2,000 units of vitamin D3, especially in the winter, especially if you have darker skin, or getting some sun in the summer, that's important. I think using multivitamin with at least 5 to 10 milligrams of B6 and some B12 in it, or a B complex, can be very helpful as well, especially if you're feeling down or tired. So that would be the third one. Fish oil, if you're not consuming any fish, for its anti-inflammatory reasons. And I think the other supplements are, I'll give you another one that's one of my favorites. You have to be careful with it. Again, if you have a history of breast cancer or if you're on thyroid medication. So this is a little bit more specific, but that is ashwagandha. There's a lot of research on it for sleep, mood, and stress, and especially for early perimenopause. So those would be my top 5, but I tend to use supplements like I use medications, so really carefully and individually. So I think if you're going out there and looking at things like DIM and CDG and Vitex and Relizan and pycnogenol and adrenal supplements, I think that requires some research and talking to somebody or reading and I think we have it on our Electra site also, some information about these, some more in-depth discussion and reading on that.
Right.
One follow-up to that. Do you have a specific brand, or do you just recommend people buy what's available and what's, reasonably priced? Or do you think we should go with some menopause company, or what's your thought on brand?
Disclosure here, like we're not paid by any of these companies. So if I mention names, these are the companies that I use in practice or personally, because like I've looked at their QA and at their products, at the amounts and things like that. So I'm usually, sorry, there's so much light here. I'm usually like wary of answering this question. So I want to be clear that this is not some, pitch or plug for any particular company. But there are some better companies out there. If you're looking at a good company that's available at a very reasonable price, there's 3 of them. I mean, 2 that I use a lot. One is the Kirkland brand, which is, I think, the Costco brand. They actually spend quite a bit on their R&D. So I like that. Can't beat the price of that. Another one is Now, NOW, great brand, accessible pricing. And another one is Life Extension. They're like blue bottles, actually, and Protocol for Life. That's white and red bottles. So those are going to be really great brands. They really do a good job with getting third-party testing, and their ingredients for the products that definitely I use professionally match the amounts that are in the literature, meaning studied, because there's a lot of supplement companies that are going to heavily market their products, and you look at, you know, whatever they have in them, and it's going to be 1/10 of the effective dose. So, and it's just marketing. On the more professional supplement side, companies like Metagenics, Designs for Health, Integrative Therapeutics are going to be, so those are sort of my to-go brands. And then, who makes Relizen? Bonafide, right? Is it Bonafide?
Yep.
Yeah, Bonafide is a really good brand. That's they put out a number of products related to menopause, and actually probiotics designed for sort of chronic vaginitis and vaginal complaints. I think that's an excellent brand, so I tend to use them a lot too.
Great. And we also have a guide to supplements, and kind of, you know, it talks about how to evaluate supplements and what to look for on the bottle, that kind of thing. So we have that in Meno 101 and on our website. But I think we are over. So thank everyone for joining us and spending this 40 minutes in your afternoon with us. And Dr. Barbieri, thank you so much for sharing your wisdom with us. As always, it was excellent. We will have this recorded and it'll be up on the platform later today or tomorrow. And so you can watch it all again if you'd like. So everyone, thank you again for joining us. Have a wonderful day. And yeah, let's smash the taboo. Thank you for joining us. Bye-bye.
Bye.